Let's learn about the emotional freedom technique, or tapping. Welcome to Reinvent Yourself, Healthy and Happy. I'm Tanya Phillips, your educator and coach. Emotional freedom technique, EFT, or tapping, was introduced and standardized in 1995. It's an evidence-based therapeutic model that can be used in a clinical setting during therapy, taught through online courses via a telephone session, and it can even be self-administered. There are over 100 different scientific studies that have demonstrated the efficacy or efficiency of EFT. EFT is a brief intervention that combines elements of exposure therapy, cognitive therapy, and somatic stimulation of acupressure points on the face and body. Studies have shown that tapping has a 98% efficacy rate with psychological distress, such as PTSD, depression, anxiety, and even some phobias, as well as physical conditions: asthma, fibromyalgia, pain, seizure disorders, psoriasis, tension headaches, frozen shoulder, pulmonary injuries, chronic pain, chemotherapy side effects, traumatic brain injury, insomnia, and it can be used to improve performance issues, for example, for athletes or students. In addition to all of this, EFT or tapping can significantly improve your resting heart rate, your blood pressure, and your cortisol. Tapping has also demonstrated improvements in endocrinal regulation, genetic regulation, and improved immune system function. It can be 74% effective against fighting cravings for up to 2 hours. And overall, it increases your happiness level. Tapping has been found to be effective with a wide sample of populations: college students, veterans, pain patients, overweight individuals, hospital patients, athletes, healthcare workers, people who suffer from phobias, victims of sexual violence, school children, teachers, cancer patients, mothers, dental patients, psychotherapists, diabetics, and even survivors of natural disasters. The best part is that approaches such as EFT or tapping can be learned quickly and applied easily. They're non invasive, non pharmaceutical, and free of any negative side effects. And treatment times range simply from 15 minutes to 10 1 hour sessions. One 5-year study with over 5,000 participants found that EFT alone was more effective than cognitive behavioral therapy, even with medication. That's huge. So, how does EFT or tapping work? First thing you have to do is identify an issue, something you're either upset about or something that you want to work on. Next, you're going to rate your SUD scale, which is a subjective unit of distress scale. So, you're going to look at that and kind of match up where you are on that scale from 0 to 10. Lastly, you're going to work through a series of repeated statements to address your issues while tapping on acupressure points on the face and body. So let me demonstrate a simple tapping exercise. There are multiple variations of statements that can be used depending on what your SUD scale is, and you may need to do multiple rounds of tapping. Remember, it can go from 15 minutes to an hour, and you might need up to 10 sessions. So keep that in mind. I will go into more depth and give more examples in a following video, but I just want to give you a sample. So here we go. Even though I am in a lot of pain with my back, I deeply love and respect myself. Even though I am in a lot of pain, I am able to love and respect myself and the life that I have. Even though I am in a lot of pain, I love myself and I love my life. I love my life that I have. I'm very blessed. Even though I'm in a lot of pain, I feel very blessed. Even though I am in a lot of pain, I am blessed. I'm alive and I'm happy. Even though I'm in a lot of pain, I can handle it. I'm strong. You can see where multiple rounds of that is going to have an effect on you. The somatic part of touching and tapping those acupuncture points and repeating those positive statements to yourself. Give it a try.